Today I'm joined by two primary care providers from Iora, Eric Harker and Melissa Beeman. Thanks for being with us, guys. All right, let's talk about it to explain what Iora is.
Yeah, Iora Primary Care is a new approach to healthcare for adults with Medicare, so mostly patients over 65. It's a team-based approach where the whole team is really set up to take care of the person and meet their expectations and goals, and to take the time to really individualize care.
I think that team approach is very important. So many times people, especially if you are an adult who's sort of been passed around from doctor to doctor, so they don't feel like they're being heard. Explain how that team approach works for you guys.
Yeah, well, when you call the clinic, you're going to get somebody on the team who knows who you are and what your needs are. When you walk into the clinic, you're going to see somebody who recognizes your face. Again, they know who you are and what your values are, and you're going to have a health coach who's assigned to you to help advocate for everything that you need. Nurses, doctors, nurse practitioners. So really that whole team just designed to get your needs met.
Tell me about this health coach. This sounds fun. Can I have one just come to my home? Because I probably could use a health coach all the time.
The health coach is really, it's a terrific role. So we hire people who really are passionate about taking care of people. And so their job essentially is to advocate for our patients and help them to get all of their needs met, whether it's providing emotional support, whether it's getting them a ride to come to the clinic or their appointments. They help them to make healthy lifestyle changes.
That's awesome.
Yeah.
I'm sure you've caught the attention of our viewers, so tell them, what kind of services do you offer?
Yeah, so it's really comprehensive primary care at our office, and so we're going to try to take care of all of the needs that you have, and if you need something that's outside of primary care, we'll help coordinate that care. We have a lab right on site. We offer transportation if you don't drive. That's to our appointments or to specialists. Really everything from telephone calls, you can email us, text us, come in to see us if you need something on the same day. We're going to try to take care of everything that you need.
You know, this makes it sound, you must have amazing relationships with your patients, which makes me wonder, Melissa, I mean, you know these people by name. I mean, they become probably more than just patients to you, right?
Yes, I think it's a very personal approach to care, and I think that's one of the things that I really like about working for Iora, is that I feel like we know our patients very well, and not just me personally, but really the entire team.
Well, and that's what means, I mean, that's the way care should be for so many people, especially if they've seen lots of doctors and gotten zero results in return. When you talk in your brochures about coordination of care, what does that mean?
Yes, I think it's something that we take, very seriously. So, as Dr. Harker mentioned, we have this team approach, and that takes us even outside of the clinic as well. So when patients are hospitalized or when they go to the emergency room, we very much have an idea of what's going on with them. We specifically have RN coordinators who are in touch with case managers in the hospital, and every day, actually, we start our day not only discussing who's going to come into our office, but we're also discussing who's admitted and who needs follow-up. So we very much have an idea of what's going on with our patients.
So for you as a care provider, for both of you, and I want you both to answer this, what's it like then to be working in this environment and working with patients like this? I'll start with you, Melissa, just because we're still talking.
Sure. I mean, honestly, for me, I've been in practice for over 16 years, and it's probably the most rewarding place I've ever worked. I'd say multiple times per week, sometimes even every day, we have patients who are making great strides in their health, working with our entire team, working with the health coaches, with our behavioral health specialists, our RNs, us as providers. And so that's very rewarding to see them making improvements in their health. And then also, we often have patients commenting how pleased they are to be a patient at Iora, and how they really just feel that they're heard, that they're known, that they're listened to, and that's very gratifying for me as a provider.
Oh, absolutely. Eric, the same with you, to have people excited about going to see a doctor, right?
Absolutely, yeah. Same thing for me. I've been practicing for 14 years, and they train us to, first thing you do, you enter the room, you apologize for people waiting, right?
Yeah.
This is in the outside world. Why? Because people have been sitting sitting in the waiting room, and then they come back and they sit in another room and they wait for you and they wait and they wait. By the time you come in,
so much waiting.
They're frustrated. And so at Iora, we have much fewer patients, so I get 3 times as much time with all of my patients. So there's time to ask, what's going on with
What's
you,
happening?
what's bothering you, and how can I help? So I feel absolutely inspired to work at Iora.
Well, Iora Primary Care is a doctor's office for adults on Medicare. At the primary care, their patients get more time with the provider and a team that really listens. Iora Care is built on relationships. The team sees people when they're sick, but they also when they're well, so they can keep them healthy. For locations and questions on how you can become a patient, please visit ioraindenver.com. They paid for today's segment.